If you've ever been hurt or had surgery, you've probably been prescribed pain medication. Standard treatment of care, right? Well, for some, this plan of care has an unplanned result: addiction. Dr. Robert Reznicki is here to alert us to a drug abuse epidemic that can especially impact older adults. Dr. Reznicki is the Chief Medical Officer at Medical Mutual of Ohio. Welcome to the show again.
Thanks, Lori.
Is this really an epidemic?
It really is. Just think about it now. Last year, in the last few years, 250 million prescriptions written each year. The number of women should pay attention because their death rate from overdoses is going up even more rapidly than men. 5 times it has gone up over the last 10 years. Men, about 3.5 times. It's the same in Ohio as it is elsewhere. So we certainly would call this an epidemic and a big problem.
Okay, what are opioids?
Yeah, opioids are chemicals that are produced in the laboratory, and they are used to try and trick the brain into not thinking there's pain there. So the pain is still there, the fracture or the back pain or whatever the problem is, it's still there. However, those chemicals work very effectively to minimize that. The problem with them is they do have a sense of well-being or euphoria that comes with them that makes people like them, and the more you use them, the more you feel that you need to get the same benefit.
But they do help, you know, stop the pain feelings at least, so.
They absolutely do, but for every medicine you take, there are risks, and so it is with these. And so people will have problems with constipation or difficulty passing their water. They are dangerous medicines to use when you're driving an automobile or using equipment. So they are medicines that you really need to use very carefully, and more importantly, they can produce problems with what we call respiratory depression, which is a condition where the breathing rate slows down, and that seems to be what's responsible for most of the deaths associated with opioids.
Oh boy. So what are some of these medications?
Sure. There are a whole bunch of these medicines, and I bet your listeners have seen this list many, many times. And so you may not know oxycodone, but you sure probably remember or hear about Percodan or Percocet or Vicodin or Lorcet, codeine, of course, and fentanyl is used sometimes for operations or even if you've had a colonoscopy. So these medicines are used very, very commonly.
Okay, so we're supposed to avoid these in order to avoid the addiction problem. So what are the alternatives?
Sure. And the first thing to remember for all of us is that never use 1 more milligram of anything than you absolutely need. How do you know? You try taking less and see if you still get the same benefit. However, there are some non-medicine things you could do. You could try ice or heat on an affected area. You could try physical therapy. You could try masotherapy or other means of things. If you do need medicines, don't start with what we call an opioid or a narcotic. Start with something milder. Maybe your doctor will think acetaminophen or Tylenol is okay. Or maybe your doctor will think taking some ibuprofen or Aleve or naproxen are all right. But make sure if you do use them, don't use any more than is written on the label and that your doctor authorizes.
Okay, and if we think we are having an addiction problem with that, is there help?
Sure, there's help. And the first thing to do is to think about what you're doing, that you're always asking for more pills than you had, or you're complaining that the pills aren't helping the way they used to. And if your doctor can help with that, great. But to get treatment information on your own, there is a substance abuse treatment facility locator. And here's the phone number, 1-800-662-HELP, or if you are savvy on a computer, here's a website that you can go to learn more about it and find a place that can help you with your problem.
All right, great information. Prescription opioids can effectively reduce the pain and discomfort caused by many medical conditions. However, they can be very dangerous drugs, leading to addiction. Follow Dr. Reznicki's advice and talk to your physician about your pain medication and any possible alternatives. My thanks to Dr. Reznicki for this important information.
Thanks, Lori.
Thank you.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com/2015 options, or call 866-488-3266.